have a hypothesis. It's probably bad. This is a pure guess. But I do not think that getting chemo could, even while you have chemo, even while you're undergoing chemo, could really deter a mosquito from taking a bite out of you. I think that it is possible, however, that you no longer have an allergic reaction to mosquito bites.
Hi, my name is Dr. Rubin. I'm a board-certified allergist. Hank Green is right that it's not likely that chemotherapy would actually decrease the attractiveness of mosquitoes to your skin, but it's possible that it could blunt the immune response. But I want to clarify some terminology here. When you get a mosquito bite, there is going to be a rash that likely results that is a normal part of the immune response because mosquitoes' saliva is not entirely benign, and your immune response is there to help protect you from a potential infection that occurs. So I wouldn't call this an allergic reaction. An allergic reaction is usually considered to be an abnormal immune response to a foreign substance that often is actually benign. Now, you could have something called Skeeter syndrome where that immune response is exaggerated, where you get a very large local reaction, get a very large rash. That's an allergic reaction. But the typical rash that you get from a small mosquito bite looking lesion, in my mind, is not considered to be an allergic reaction. Now, chemotherapy could potentially decrease the immune response through multiple mechanisms. It's going to depend on what type of chemotherapy regimen you have and what cells of your immune system are really affected by it. But the typical response from a mosquito bite is going to be you have mast cells that are at the surface of your skin that's going to release histamine and other chemicals to cause that localized swelling and itching, and then a secondary delayed response with multiple immune cells coming into the fray like T and B cells, and they're going to maybe potentially cause that skin to harden a little bit where you get that hardened part of the bite that occurs. Now, I don't know this person's medical history, so I can't verify any of this, but it does seem probable that chemotherapy could blunt the immune response. I don't know if it would necessarily completely eliminate it, but this is an interesting question.